Right. Thank you. My name is Lisa Selbie. I'm chair of the research committee at HeartKids. And I just want to make apologies today for Paula Murray, who is our general manager for research and support programs. She would have loved to have been here to meet you all. And I'll encourage you to meet our HeartKids staff at the booth, which is our state manager in South Australia, Tanya Potts, and Anna, one of our family support managers. So I'd really encourage you to meet them. But look, just really quickly, I want to introduce what we are. We're a not-for-profit that has been here supporting the community for 30 years. It was started in Melbourne by absolutely parents such as you who were wanted to advocate for their families and their children and themselves. It's grown a lot. We're now one big national organization, and that brings along challenges as well. But whoops, oh, just turned it off completely. There you go. So you all know what the facts are around the occurrence of congenital heart disease. The Fontan community here, you're one part of that wider group of community in Australia, which is over 60,000 individuals that have congenital heart disease. You know the facts, but the facts that are most important to you are your journey, what your pathway is. And what HeartKids is there to do is to try to help you navigate to get access to the services and support and community that you need on your own personal path. So how do we do that? I think the talks this morning have really set us up to understand the power of advocacy. And as Rachel said, it's you advocating for yourself, your child, and your family that will have the most impact on where you end up and the quality of your life. And that's what we're helping, is trying to connect you with that information, the services, the access to advocacy paths, and the research that'll help you achieve the best you can. So what do we then do? First up is advocacy. The reason we got involved in an early stage supporting the Fontan registry was because of the power of this proof of concept. It's a registry that brings together the community, that not just brings together the patients and the families, but the surgeons, the cardiologists, the health professionals, the nurses, the consumers as well, driving what research is needed and what services are needed. So it's been a really great journey that we've all been on. In terms of our advocacy, the power of having a coordinated voice is important. In Australia, we are dealing with 5 different state governments and a federal government. So the ability to advocate in the local area is critical, but when we come together, our voice is much more powerful. And that's really been demonstrated in the last 4 or 5 years as this community has pulled together the Fontan community as well as the wider congenital heart disease community. And we've managed to get the Commonwealth government to hear us through some roundtables last year at Parliament. And that's resulted in them funding the first ever Congenital Heart Disease National Action Plan. And many of you will have seen some information about that, but we've pulled together working groups over the last months in order to identify what the priority areas are that we need to invest in and plan in over the next 5 years and coming years. And it's that plan that we're now at sort of draft stage after lots of consultation. That will go out on our website through social media to public consultation in September 19th. So I invite you to at least have a look at it. I promise you that everything you think you need is not going to be in that plan, but what we're trying to do is get the infrastructure there so that you will be able to access the services you need. So please have a look at that and understand how much we're there to help you advocate. So I started with the advocating, but in order to advocate, you need the information and the up-to-date facts on what the health community knows and what is out there in the community for you. And so part of what we're providing is a helpline where you can just call and ask, and if we don't know the answer, we'll go look for it for you. But community and information fact sheets that have been reviewed by our health committee, by the health professionals that are in this room, that give you what we know today. And remember that those fact sheets, that information will continually change as research informs what the opportunities and hopes are for the future. Karen mentioned Dominica's work on the sexual health and pregnancy fact sheet, and that's provided and was identified as a need because of what you as the patient community has said you want, through the surveys that Karen has mentioned and through other work that the Fontan community has done. And I'll mention a bit of that power of a survey in a moment. And again, that information we've got on the Fontan Registry website and the HeartKids website, and we very much want to be working together, providing consistent information for you. So, as I mentioned, I'm chair of the research committee at HeartKids, and over the years, we've not been able to invest significantly huge amounts of money in research, but all of that money, over $3 million over the last 10 years, has come from donations. It's not come from government. And what we've done is look to the professionals, the health professionals in this room and wider, and say what needs to be funded. These are small grants, but they've been very useful in establishing important pilot studies, such as the Fontan Registry back in the day. As part of that, we're also funding a pilot binational registry between Australia and New Zealand to look at all congenital heart disease patients. And this would not have been possible if the Fontan Registry hadn't been a success. And I can tell you it's the same people involved in both. So you've got the same team trying to solve the problems for the future. And as part of our advocacy work, Greg Hunt announced at the end of last year that congenital heart disease will be the 5th mission of the Medical Research Future Fund. And this is really, really important, putting us on a stage. You know, every other disease group out there is trying to get some traction and awareness with the deciding bodies that will decide where funding goes. So that is a start of $15 million for research over 5 years. That's nothing compared to what is required or what has been devoted to other areas. But what it does is it helps us leverage to look for additional funding. And none of that can happen if we don't know what we need to do research on. And that's what the action plan is for, is to get the consensus of what research is needed. It's not just your cardiologists and nurses and allied health professionals deciding that. It's actually you who are telling this community what is needed. And that's why HeartKids is involved in facilitating it. So ultimately, once we've advocated and got the resources there for those services, you know, and all of you have experienced various pathways in the health system and external, it's always a challenge. The services are never equitably there, and they never will be there. It's about getting the information to find them. And if they aren't there, to empower our larger voice to advocate for those services. So simple examples are NDIS. You know, the NDIS is going to find it difficult to support all the people that need to be supported. But even our community finds it difficult to access that. We know there's financial stresses. It's trying to access additional sources of financial support when you've got to travel cross-state, et cetera. So over this year, we've probably supported over 6,000 families. Much of that, half of that, is going to be at the hospitals, but also outside of the hospitals, we're offering support and access to existing resources or information, or spending probably 3,000 hours on the phone connecting digitally with families who need support. And remember how big Australia is. That's one of our challenges, is how to get to the regions. And it's something that government is very keen to hear about your regional and rural remote needs. We also offer a lot of what I think people would have thought of HeartKids as in the past, which is sharing that shared experience that we all have. We might walk very different personal paths through the health system as your child is born and grows to an adult, but we're also sharing those experiences. And the power of that counseling, that sharing, is we simply achieve in information sessions and morning teas and play groups, which we have hundreds and hundreds of. But a lot of that also is, what can you do? You can access those, you can look for those, you can start those up, But we also are trying to formalize that a bit and offer some training to parents who want to mentor and share experiences with other parents who are walking similar paths. And that's our Peer as Mentors program. But ultimately, as Karen mentioned, you've got to cope with what you have. And coping as a family can be very challenging. That's where the shared experiences and the support groups are helpful. And we're also been working with Alan Jackson, a psychologist in Melbourne, to roll out a family as coping program, which is actually psychological counseling support intervention to help. Does it reach everybody? No. But one of the points is trying to understand what's in that. We're actually funding that to become a digital, online, accessible intervention as well. But, you know, the point is that we take you to be the advocate for yourself, to reach out to us. Please tell us what you need, because that's the important thing. So the way you tell us what you need and you get what you want in 1 year, 5 years, is to partake in these surveys. And I know you're probably inundated with surveys in life in general. But the ANZFAC, the Fontan Advisory Committee, and the members, I don't know how many members are here today. Can you stand up? Because you are really important people who've had a voice to this community, and other people in this room have also done a lot of work around that. And we thank you very much. Now, they've written a survey that's on the table outside. To advocate as a whole, we need you to fill out those surveys and give the responses. It's so important. At the HeartKids desk as well, I would encourage you, if you haven't signed up to HeartKids in any way, if you're willing, provide your email address, and we'll also send you a link to the information we provide. But we also have a survey for the large congenital heart disease registry, which is in pilot form. And that's asking you not the questions that ANZFAC will be asking, but asking you more about what's been the impact of the journey through this. How much have you spent financially out of pocket? How difficult was it to get to your hospital or your doctor's appointment? You know, were you offered any mental health support or psychological support? And again, that's the information that resonates with government. And one of the most important visualizations for me was going to Parliament last year in September and having 3 tables of the doctors and surgeons and health professionals you know, a table of patients and family members, and then a table of the government, state government and federal government, who are just making the decisions about what you get for your future and support. And Greg Hunt, Steve Chobo, and four other ministers literally could not believe that before it started, you saw patients going up and Eve's giving them a hug, and the nurse having a chat with one of the patients, and the state government person talking to one of the young adults and being amazed that they were there and what they've achieved. And literally before we even started the round table, we had the commitment for the National Action Plan. So that doesn't happen normally, and it only happens because this community has come together. So thank you very much. Get involved.